The FDA is not yet taking a definitive stance on whether or not booster shots are needed to help protect people from coronavirus infections. This comes just a few days before a key advisory committee meets on authorizing an extra dose of Pfizer's vaccine. CBS News correspondent Omar Villafranca reports from Tennessee, where first doses of the vaccine remain low.
Tonight, Pfizer and now Moderna are making a major push for booster shots. But the Food and Drug Administration is staying neutral. Today, the FDA released new documents from Pfizer ahead of an advisory panel's meeting on Friday to discuss COVID booster shots, claiming that protection from its vaccine loses some effectiveness after 6 months, but improves to 95% after a third dose. But in a separate document, FDA staff noted that they've yet to verify some data that would support an additional dose, saying the current vaccines still afford protection against severe COVID-19 disease and death in the United States. But in much of the U.S., the issue isn't third doses. It's convincing Americans to get their first dose. In Tennessee, less than 45% of the population is fully vaccinated. In Shelby County, children make up 35% of the active cases from the last 2 weeks.
If we could get our vaccination rates up even more, if we could get people to mask consistently, we would be doing the job of protecting those kids who are under the age of 12, who really don't have the option of being vaccinated right now.
17-year-old Jacob Rodriguez got COVID. He was unvaccinated.
Felt really tired, headache, couldn't taste nothing. It was awful.
The nurse comes in and he's like, it looks like Jacob's played 4 quarters of football with no pads on the inside of his body.
When you hear that from a medical professional, what are you thinking?
Truthfully, God, where are you taking us with this? You know, am I going to be on that list of numbers? Is my kid going to be one of those numbers?
President Biden met with CEOs today to discuss the vaccine mandate for businesses with more than 100 employees. Here in Memphis, that means locally based businesses like FedEx and AutoZone. But at this free vaccine clinic, we noticed that the traffic was slow, just like the vaccination rate. Lana?
Omar, thank you. For more on this, I want to bring in Dr. Adam Brown. He's an emergency physician and the COVID-19 National Task Force Chair at Envision Healthcare. Dr. Brown, thanks for being here. So what do you think this review from the FDA means for the potential approval of booster shots in the future?
Well, we'll have to see how this goes because, booster shots in and of themselves are not that controversial. Remember, we get tetanus boosters. We also get hepatitis B boosters. But what makes this a bit more controversial is that we've seen in some countries around the world that booster shots have been effective in preventing breakthrough illnesses. We saw that in Israel. But what we don't know is really the timing of when these boosters should be given. We also don't know, and as was mentioned in the previous report, is if people are going to take them. Well over 40% of the United States still remains fully unvaccinated. So there does become a bit of a logistical issue that we have to consider if we are going to permit booster shots for the entire population of the United States that have already received vaccines. That said, we do have some evidence that boosters are important for especially the elderly, as well as some that received the vaccine very early when the vaccine was available, i.e. healthcare professionals.
And Dr. Brown, I want to talk to you about children because we just heard Omar report that they account for more than a third of new cases in that Tennessee county. Cases among kids nationwide have been going up. What should parents know about the risks now?
Well, we've seen an over 200% increase in children with COVID-19 since July, which is just astonishing. But it's also not that surprising as kids are moving from more outdoor type of activities to indoor activities like school. So there's a few things that parents can do. And one, that is ensuring that their kids are masked. So having a good quality surgical mask or better is an important way to mitigate children getting the virus. Also, Also, those who are over the age of 12 can get vaccinated, so they should definitely be vaccinated. In some states like Tennessee and Georgia, still there's a very low number of kids that have been vaccinated that are eligible. The other thing that parents should do is really encourage their schools to have a mask mandate and require teachers to be vaccinated. And then lastly, if kids are going to be interacting with other kids outside of school, which they probably are, they should be doing as many things as possible outside, but also interacting with families who have vaccinated parents. So ensuring that parents are vaccinated and the parents of the kids that they interact with are vaccinated are ways to mitigate some of the spread to children. Lana?
You mentioned, Dr. Brown, that 49% of Americans still are not fully immunized against it. But there is actually some good news when it comes to vaccinations, because the percentage of Americans who say that they will never get vaccinated has fallen from 24% in January to 15% now, according to a Monmouth poll. Obviously, those people still need to get their vaccinations. But what is your message to people who are in that 15%, who are still hesitant?
Well, I think the first thing that I say to folks is more than 96% of physicians have been fully vaccinated. That was by June. These are the people that take care of you in the hospital, that treat your children, that you go to answer questions about medicine, about your healthcare condition. And so I think that's an important message. Number one is that the physician community across the country have been fairly ubiquitous in their response that the vaccines are safe. But the other thing is I'd like to point people to is to show them who's going to the hospital right now. And the large majority of people going to the hospital currently are those who are unvaccinated. And the scientific community across the world is unanimous in stating that the vaccines are effective in preventing severe illness and disease and death. So in the large majority of cases. So I think that's an important message that we need to get across to everyone, is that the physician community, the medical community are fairly unanimous in stating that that the vaccines are very safe. But then the last thing that I also want to do is listen to the concerns. As I've talked to my own family members and friends and colleagues and patients, there's oftentimes a real legitimate reason why someone does not want to get the vaccine. And oftentimes that reason is based upon dis or misinformation. And so spending time to be empathic and listen to the concerns of our patients and our friends and family is an important way for us to see what we need to do to encourage them to get vaccinated and answer their questions.
You know, Dr. Brown, you mentioned talking to people about who's being hospitalized right now because of COVID, and it's the unvaccinated population. But there's still also a lot of people who don't maybe make it into the ICU, but are still suffering the long-term effects of COVID. So I want to ask you about that. The National Institutes of Health announced Wednesday that it's awarding researchers at NYU nearly $470 million to study long-term COVID. What more can you tell us about how many people continue to experience symptoms long after the initial infection?
Well, the long-term COVID or long hauler COVID is really a bit of a mystery. We know it occurs, but the thing is we don't know necessarily why it occurs in some populations. We know it occurs because someone got COVID-19, hence another reason why people, even young people, should be vaccinated. But what we don't know is why. There's some evidence that there may be an autoimmune response. There's also some evidence that there may be associated with some residual virus within the body. But this is the reason why we need more research in this space, because until we know the pathophysiology or the reasons why someone has long-term or long hauler COVID, we don't really know how we can treat it. And so I think this is an important step in starting to address a real issue, because some studies are indicating that anywhere between 10 and 30% of people that have COVID have some symptoms of long-term or long hauler COVID. So I think this is a great step in the right direction.
All right, Dr. Adam Brown, thank you for joining me, and thank you for all that you do.
Thanks for having me again.